Our club has always been a forum for public figures, thought leaders, and decision makers to share their ideas. Here, we offer access to dynamic political, business, and public personalities.
We are dedicated to encouraging debate on the issues that matter to this city, this province, and this country.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts, and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Good afternoon, everyone. My name is David Simmons. I'm president of the Canadian Club Toronto. Today, I'm joining you from the traditional territories of many nations, including the Mississaugas of the Credit, Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Toronto is now home to many diverse First Nations, Inuit, and Métis people, and we acknowledge them as the original caretakers of this place. Today, we're joined by a panel of medical experts, Dr. Kelly Grindrod, Dr. Jahu, and Dr. Christine Palmay, who will join in conversation with André Picard. They're going to discuss Canada's need to catch up on routine immunizations. Before we hear from today's panel, I wanted to go over a couple of housekeeping rules. You can click the switch stream button on the bottom of your screen if your internet is slow. The video quality may decrease, but the sound quality will remain strong. Once you click the questions tab, you can enter your questions in the window and they'll be sent to our moderator. I'm sure he will have a look at those questions and use the ones that help move the conversation along. And if you're having trouble, there is a request help button at the bottom right corner of your screen for technical support. Let me take a moment to thank our event sponsor for helping make today's discussion possible. We are grateful for the generous support of GSK. Because of GSK, today's event is free of charge. The Canadian Club is a nonprofit organization that's been convening Canadians for conversations for over 125 years, and it's because of our sponsors that we're able to do so. Another tradition of the club that has managed to endure social distancing in our virtual programs is the toast to our great country. So if you're able and you have a glass nearby, I'd ask you to join me in a toast to Canada. To Canada. I've been drinking much more coffee in these toasts than when we're in person. Now let me turn the podium over to Faris El-Rafai, President and General Manager of GSK Canada, to introduce our speakers.
Thanks, David. As David mentioned, my name is Faris El-Rafai. I'm the President GM of GSK Canada, and as one of the world's largest vaccines companies, delivering vaccines that help protect people at all stages of life, I'm really honored to be a part of today's event. It's a very timely and important discussion for us all. As a leader in vaccine development, GSK manages a portfolio of more than 20 vaccines that protect the health of children, adults, and seniors, as well as another 15 vaccine candidates in our development pipeline. We're very proud to leverage our knowledge and expertise to help advance immunization science, but we know that bringing vaccines to vulnerable Canadians isn't a goal that we can achieve on our own. It requires a deep and sustained commitment to multiple partnerships and alliances across the healthcare sector. We have a long track record of collaborating with governments, healthcare providers, regulators, academic institutions, non-governmental organizations, and other key partners to tackle public health challenges in Canada and around the world. The global response to COVID-19 has also showcased the pivotal importance of cross-industry collaboration and innovation, especially to our pharmacy partners that have delivered more than 15 million COVID-19 vaccines across Canada to date. More than 2 years since the emergence of this virus, the global pandemic continues to shine a spotlight on the role vaccines play in protecting the health of populations across the globe that help bring economies back from the brink of collapse. Crisis is an effective mobilizer of energy, attention, and effort, and the collaboration that brought coronavirus vaccine to millions of Canadians are well worth celebrating. And we have much to be thankful for as our country begins to emerge, hopefully, from the worst of the coronavirus. And yet, massive public health challenges still need to be addressed. With the vast majority of Canadians now vaccinated against COVID-19, we need to work harder and together to apply the same urgency, effort, and access we used against the pandemic to reverse this dramatic drop in routine immunization and ultimately drive progress to reaching national vaccination coverage goals again. Ironically, Canada's relatively high rates of COVID-19 immunization make it even more striking that only 3% of older Canadians are protected against other vaccine-preventable illnesses, including debilitated diseases like influenza, pneumonia, and shingles. So along with you, I look forward to hearing from today's panelists on how we can best do this, how we can take the lessons from the pandemic and apply them so that we collectively are helping protect people against infectious diseases at all stages of life. Today's panel features Dr. Jahu, CEO and co-founder of 19 to 0 and corporate medical director and physician at the Cleveland Clinic, Dr. Kelly Grindrod, associate professor, School of Pharmacy, University of Waterloo, and Dr. Christine Palmay, physician at Midtown Health and Wellness Clinic in Toronto. So without further ado, I'll turn it over to today's moderator, Global Mail health reporter and columnist André Picard, to get the discussion going. Thanks very much.
Thank you, Ferris, for that kind introduction and for setting the stage for today's discussion, which is really important and timely. Talk about vaccination beyond COVID. Jo, I thought we'd jump right into it. I want to start with you. As you heard from Ferris, we have really good COVID-19 vaccine coverage. About 82% of eligible Canadians have at least 2 shots, so we're doing well. But tell us what's happened with the rest of all these other vaccines that kids and adults should be getting. Are they still getting them during the pandemic?
Yeah, no, really good question. The answer is there's been dramatic declines in uptake of other vaccinations. About 1 in 4 Canadians have missed, both children and adults, have missed one of the routine vaccinations over the past 2 years of the pandemic. And I mean, well, that sounds like a lot or a little, but it's actually really, really huge. Before COVID, the WHO called vaccine hesitancy one of the world's largest public health threats. And that was at a time when, we were worried about measles vaccine uptake, which was sitting at 90%, not 95%. But uptake has fallen dramatically. For adult vaccines, uptake was low in the first place. And for that 25% plus fall to occur, it's quite bad. For some of the pediatric vaccines, especially the school-based ones, we've seen completion rates going from 70% to less than 1%, just because of the combination of lack of access and other fears about accessing these during COVID. And so, I do think the lack of routine vaccination, both children and adults, are going to be one of the most pressing health challenges we'll have to address as COVID and Omicron begin to wind down.
Yeah, and we'll talk about some of the causes of these, the fall in numbers. The 1 in 4 is quite a disturbing number, but it's not because people are necessarily anti-vaccine. There's all kinds of technical reasons, and we'll get into those. And maybe, Christine, you can help us with some of those. What's keeping, for example, parents from getting their kids vaccinated during the pandemic?
So I think one of the big take-home messages that emerged from the 0 to 19 study, or 19 to 0 study, was that people want to get vaccinated. So there's not so much a hesitancy en masse. They didn't know how. Public health was telling people to stay home unless you needed medications or food. The prioritization of vaccines was something probably that was not well conceptualized by medicine. As a primary care doctor, it was quite scary. Many offices didn't have access to PPE. Some doctors weren't set up for virtual care. So what became urgent maybe didn't align with some of the recommendations that the WHO, the CDC came out with very early on in the pandemic, saying, we don't know what's happening in the next 6, which became 12, which became 18 to 24 months, but we're worried about vaccine care. Patients didn't necessarily know whether their doctors had access available. And, as a result of COVID, I think one of the biggest silver linings is that there was this new awareness that you can get your shots elsewhere. We were doing COVID immunizations in pharmacies, we're doing them in convention centers. So the old adage of going to your family doctors, who's open 9 to 5, Monday through Friday to get your shot, just isn't convenient. And that study highlighted that, patients want access that's convenient and in a geography space that's perhaps close to home, but also safe. I'm on the 6th floor of a medical building with an elevator. It's really hard to social distance when you're providing mass immunizations, such as influenza, COVID, but also for catch-up purposes.
Yeah, and we'll get into some of those challenges and how we can correct them post-COVID or maybe even now while COVID's still raging on. Kelly, I want to bring you into this. We heard Christine mention that we started thinking a little differently. We started thinking about pharmacists doing more vaccines. Can you talk about that? It varies from province to province, but a lot of vaccines are now given by pharmacists.
Yeah, we started that maybe in the last 10 years. It was pretty slow at first, with some provinces having pharmacists do select vaccinations like flu shots. And then slowly it expanded where, as other provinces also picked up flu shots, some provinces went back and added things like travel vaccination, adult vaccinations, think things like shingles or pneumonia. There's been a reluctance to do the regular routine childhood vaccinations. And I think that's a big conversation that needs to happen post-pandemic, where you've had pharmacies now providing considerable numbers of vaccinations to huge swaths of the population. So not just adults, older people, teens, children, a lot of people, this is their most accessible place. And to Christine's point, you're in and out of a pharmacy faster. We also saw pharmacies come up with new ways of doing it though, too. So sometimes it was vaccinating people in the car when they didn't feel safe to come in. And I would say even at the mass vaccine type sites, when we'd run a drive-through, who we thought would come through a drive-through was not who we actually saw in a drive-through. So we thought it would be people who maybe had kids. So they did come in with kids in the car and you could get the whole family done at once. Well, it turned out that was really efficient. Pharmacies doing that too. But similarly, you'd have people with heart failure who have oxygen, and it was actually hard for them with a mobility issue to get into a building. And if you can vaccinate them in their car, all of a sudden it's a lot easier. So I think with the pandemic, pharmacies were a big part of that. But it's opening up the questions around, okay, what does the patient need and what kind of a patient benefits from this? Not where do we think it would be nice for people to have more convenient access? So convenience has been a dirty word in some cases. We said, okay, well, because it's convenient, that makes sense. But no, what we're realizing is it's not convenience, it's actually accessibility. And that's a very different way of thinking about vaccination.
So John, let's talk about how can we've been more innovative during the pandemic about where we give vaccines and how can we carry that over to normal life? How can we make this a permanent way of thinking?
Yeah, no, I think one of the best things of silver linings of the pandemic has been a lot of the innovative solutions we've developed. And to what Kelly was saying, I think that using pharmacists to deliver vaccines, especially adult vaccines and vaccines for older children, are going to be quite critical to getting over this or recovering from this 1 in 4 deficit of people who've missed vaccines. That is, I think, part of a broader set of interventions would lead to better access. And, I think throughout this pandemic, we've learned just how important access is. We've seen huge disparities in areas that have more access to the COVID vaccine, high uptake, and areas with less access. And there's been actually remarkable work done by groups to actually bridge that access gap. And so I think activating more providers is key. I think another thing that we saw during the pandemic that warmed my heart and was very effective is that we saw lots of groups not normally involved in healthcare and certainly not normally involved in vaccinations, ranging from, immigrant serving organizations to large employers, like TD Bank and others, stepping up and really providing things like vaccine education to their employees, making certain policies that made vaccine more accessible. And I think that, we all know a lot more about vaccines now. And I think maintaining and continuing to leverage the work from these non-health partners is going to be key moving forwards. All of this really, though, I think does come down to, a sense of, one, the urgency and the importance of moving forwards. And everyone's really tired, especially public health. And so, we can't put too much on them. Speaking as somebody who does public health, I'm pretty tired too. But I think we have a huge network of people ready and willing to address some of the big challenges we need to deal with after Omicron.
And Christine, on that theme about how we should do things differently, a lot of our vaccination has been based on school-based programs. That really fell apart during COVID. A lot of kids weren't in school. Public health was occupied elsewhere. How do we change that? How do we change this mindset that it has to be given in school? And we're very rigid about that. We have been for many years.
Excellent point. So, there's two two categories. I think there's an ethos category. So for whatever reason, primary care doctors tend to be entrenched in tradition. And we have to, understand that if nothing else, the pandemic showed us that what we did was inefficient and likely not kind. The true tragedy would, to go forward without making changes. So having primary care providers like myself champion collaboration, actively say when I'm prescribing, a shot that perhaps has to be filled at the pharmacy, like shingles, invasive pneumococcal immunization, you're there anyway. Have the pharmacist who I trust give you the shot. So having consistent messages across the board that I support collaborative care in terms of immunizations. With the school-based programs, it's a complete tragedy right now. So in Ontario, we have different public health units. Everybody functions differently, but certainly in Toronto, there is no catch-up clinic opportunity within the public health system. So school-based programs are still closed. We don't know when they're going to open, no plan yet. So the onus is on myself as a sole family medicine doctor to recall patients who may not even know they're eligible or their parents because they're grade 7s, have them come in, write a note to public health saying so-and-so patient needs this vaccine. Sometimes I have to order per patient, sometimes we have to batch. Logistics don't make any sense. There should be some kind of centralized mechanism in place. So not only does there have to be efforts from the top, but I think as primary care in the trenches, whether you're a pharmacist, a family doctor, a nurse practitioner, having a grassroots movement where the message is, let's work together and just make sure those shots happen. Where, it doesn't matter. I think we'll probably spend a bit of time about record keeping. But even childhood immunizations, in the death of winter with Snowmageddon, I had several patients booked. A parent's going to come with their toddlers and new infant with a stroller. It doesn't make any sense. So, as Kelly so astutely pointed out, we need to reframe the entire system.
And Kelly, I've talked quite a bit so far about childhood immunizations, but a lot of vaccines are for adults, for older people. We tend to forget that. How do we do a better job of that? Because as we heard in the introduction, we have very, very low coverage. I just got my shingles vaccine at a pharmacy, but there are very low numbers. How do we work on that other end of the spectrum?
There's been an interesting thing. So there's some research suggesting that so most adults think they're up to date on their vaccinations, but very few adults are actually up to date on their vaccinations, a very, very small number. And so people are often very pro-vaccination. They would like to be fully vaccinated, but they just don't realize that they're not. So I work in healthcare. I've had vaccine mandates that I've worked with for years and years. Every time I'm in a new job, every so often I have to provide records. And that keeps me up to date, that accountability of, well, when was your last tetanus shot? Or did you get your measles, mumps, rubella? If I get a hepatitis B vaccine, it's not just showing I got a hep B vaccine, it's actually having titers to show it worked in me, that I had an effective vaccination. So I'm in this world where it's expected that I stay fully vaccinated. And I forget that people around me who don't work in that space have no one often telling them, unless they go in for, say, a blood pressure check or just a routine every few year assessment with their family doc, who might mention it. We have some research with pharmacists too, pre-COVID, pre-pandemic with flu shots, that pharmacists were really good at giving a flu shot when someone came and asked for it. So they could set up a booking system. They could say, book your appointment. The person then takes the initiative to book their appointment, comes in, or a script comes in for something like a shingles vaccine. Okay, great, I'll give this to you. They're not as great at proactively offering it. So saying you're here for your medication like blood pressure, have you had your vaccines done? And so there's a lot of conversation now about incorporating, we do medication reviews, but they need to actually include vaccination reviews. So having every adult go through some sort of an assessment, or even just people being aware, some sort of a message. But we don't have centralized systems. We don't have centralized records. We really don't know if you have a patient in front of you, without asking, without being prompted, do you have everything that you need? And I think the hard part is, turns out they don't know either, that they don't have everything that they need. So this is really, in large part, talking about a huge public awareness campaign around what fully vaccinated means as an adult, but then also having tools that family doctors can use, public health can use, pharmacies can use, patients can use to find out what it is that they actually need to get if they haven't gotten it yet.
And while we have you, let's talk about what is fully vaccinated as an adult. Flu, shingles, pneumococcal, maybe tetanus, diphtheria, pertussis update. Anything else I'm missing?
Well, I think actually those are the really big ones. And there's interesting things that happen. So for example, grandparents might have experienced this where their adult children have their first grandchild. And all of a sudden the conversation is, well, are the grandparents vaccinated against whooping cough? And so you'll see, I've had neighbors who'll come over and say, I didn't know I was supposed to get this vaccine. So there's schedules, we have the Ontario schedule around what's expected for vaccination. I'd say making sure you're vaccinated against hepatitis is also a pretty important one. So, we do this with children now. My own children were born, my daughter was born in Vancouver. We did Hep B in infancy. Now they do it here in Ontario in grade 7. But if you weren't going through those childhood vaccinations at the time that was initiated, you might not be protected against things like hepatitis either. So there are some others that may have been prompted because of travel, but if you're not traveling, you may not have realized that you could also get them as well. I'm happy to turn over to the others for any that I might be missing, but yeah, those are the main ones that I'd be concerned about.
Great. And I just want to remind the audience, you can send in your questions. I'll incorporate them into the conversation along the way. There's a couple trickling in, but don't wait till the last 5 minutes. Traditionally, people send 100 questions in the last 5 minutes, and we won't get to them that way. So Joe, I want to turn over to you again. We've alluded to record keeping a couple of times. If we're going to have different places to give vaccines, record keeping becomes all the more important. And I do know from experience, record keeping is quite abysmal. I have my excellent high-tech vaccine record here. How do we fix that? How do we fix the record keeping part of it?
Yeah, I mean, I think COVID's done a lot to help us improve our record keeping. I think after the first SARS, when I was pretty young for that, there were all these reports saying we probably need to have better medical records, better connections between, organizations and provinces. And because of the need of COVID, basically, the province of Ontario, all the provinces didn't have registries, built them. And they built them very quickly, which I think is a testament to what we can get done if we need to get it done. And so I think that, what will begin to happen, I'm sure, is that, these registries that were built for COVID can easily be repurposed and include other vaccinations. And we'll begin to move away from the yellow cards that we see so much in Ontario to what Alberta has, which is where I'm from, which is actually a centralized database of everybody's immunizations going back 30 years. So, whenever I need to get a vaccine, I just email public health or a vaccine record and ask them for it. And so there's been, light years of improvement that have happened over the last year compared to the last 30. So I'm pretty actually happy with that.
Now, this centralized database, but Alberta does have a good one, but it's just Alberta, right? So we don't really have a pan-Canadian record keeping yet.
No, we don't. And, I think that may be pretty difficult. I think, as you know very well, healthcare remains a provincial territorial jurisdictional issue. And, there isn't so much sharing, I think, between the provinces and the feds when it comes to personal health information. But I think, making sure that every province has a registry and then ensuring there are ways to port records from one province to another, which again has been sort of built a little bit during COVID, is going to be key. But I'm too optimistic about a pan-Canadian record at this point.
Okay. And Christine, I think like me, you have one of these really fancy high-tech records, of course. As a doctor, when someone gets a shot at a pharmacy, you don't know, right? Unless they tell you.
Not necessarily. In equally a tech-savvy manner, I sometimes get a fax. Exist. Sometimes, the reality is now with COVID uptick and, the influenza vaccines, pharmacists are busy too. So I am more optimistic and hope that at some point we will have a coast-to-coast record-keeping hub, and whether each province filters into a master hub, I don't know. But I actually think it's a wonderful thing to engage the patient. So it's not a perfect solution, but there's a Can Immunize app. You can download it for free off the Can Immunize site. Patients forget their cards, health cards, they forget their wallets, nobody forgets their phones. And it's multi-user, coast to coast, and patients can actually record what they got. So, initially when the COVID vaccines rolled out, there were some logistics about how to get other shots and blackout periods. That since those restrictions have been lifted, but it was quite confusing. A patient came in for a tetanus shot and I had to know where they got their COVID shot when, and they just flashed their smartphone at me. So I have a particular hatred for those yellow cards that come soaked in whatever, you can't read the writing. Is it 1971? Is it diphtheria? Who knows? But I think engaging the patient is also useful because there's a bit of an education piece. The app will prompt the patient, what they're due for based on basic demographics when their next shots are. And just to highlight something that Kelly said, there's been some wonderful moments in this pandemic to have discussions with patients. Never before could I quote NACI, CDC, and now this is, Zoom cocktail party chatter. Everybody knows about these massive organized bodies. And so when a patient comes in, I can have quite a different level of a conversation about a vaccine and also opportunities. So a case came in where I was doing a catch-up for a grade 7 student who needed an HPV, a human papillomavirus shot. And, her father was there, and I'm seeing a lot more fathers bring their kids in because they're home working. And I sort of looked at the father and I said, we should probably talk about why perhaps this is a good immunization that you should get. That conversation may never have happened. So I think the other thing is harnessing opportunities when the patient's there for their influenza or their COVID shot. They're sitting outside my office, they get a sheet saying, thank you so much for making immunizations a priority. By the way, this is a list of other things to consider. Embracing those key opportunities, embracing this newfound knowledge, I think it's a wonderful thing and another silver lining of the pandemic.
Great. And these acronyms are part of our daily conversation but for people who don't know, NACI is the National Advisory Committee on Immunization. CDC is the US Centers for Disease Control and Prevention, both really good sources of information online if you want to look them up. And I want to thank people, a lot of questions rolling in, so I'm going to throw them in. But Kelly, I want to get you on this record keeping aspect. You've lived in 3 provinces, you have kids. This becomes hard to manage for a parent, even one who's a healthcare provider.
Yeah, when I had moved here to Ontario, and the first time I got that yellow card, I got it and I went home and I tossed it because I didn't know what it was. And then when my kids went to school and I had to prove vaccination, I was given that note that said your children have not been vaccinated. If they are not vaccinated, so on and so forth. And I didn't realize that note, that yellow card, that's such a province-specific tool, right? And so I really struggle with that idea of, everything is paper. It's not a special paper unless you know that social meaning. So imagine new Canadians, people coming here. And I can say from pharmacies right now, one of the big struggles is just even like COVID second, third doses when a first or second dose was out of province. Out of province can mean international. So then this talks about every time you move to a new province, you come to Canada, it has to be registered, then every new province you go to. Most people aren't going to understand that nuance. And I think, I have my own, being from Alberta originally and living in Vancouver and then living here, I have these paper records of all my vaccinations. Again, having been a healthcare worker, I've had to repeatedly prove that I'm vaccinated. But I often wonder, if we're displaced by a flood or we have a house fire or something like that, I'm not sure I'd have those records anymore. And there's this slow migration into systems, but it's really, really been a challenge. Even COVID record keeping, we have come forward so much more in the last couple of years and accomplished things that we would have said were almost impossible 3 years ago. But these systems are imperfect still as well. And that provincial restriction is actually probably one of the biggest barriers. People move all the time. You grow up, you leave your parents' house, you move to another province. The fact that you don't move with your record and you have to restart each time, that's a real barrier. So I actually think we have a considerable amount of work post-pandemic, but the pandemic has showed us how to fix it. We just actually have to do that now.
Good. You've all put out a good challenge there to the IT people in healthcare. And I'm glad Christine gave a good shout out to the Can Immunize app. It is a great one. It's voluntary, but it's really helpful. So John, I want to turn to you. A lot of questions coming in about vaccine hesitancy from the audience. So let's talk a bit about that. I know from experience, there's not a lot of people who are really hardcore anti-vaccine, but there's a lot of people who are hesitant for a number of reasons. So can you give me a sense of why do people hesitate to get their vaccines, or why are they not vaccinated?
Yeah, so I think it's usually a constellation or a combination of 3 factors, right? One has to do with your trust in the vaccine, which are like safety, right? In a way, and a lot of people are concerned about, is this vaccine safe for my child? Is this vaccine safe for me? Is it going to mess up my DNA sometime down the line? Another is concern or how worried you are about a particular illness or disease, right? And so we've seen more uptake in countries with lots of COVID, basically. Australia shot up from very low uptake to very high uptake very quickly. And then thirdly, the issue that we've been talking a lot about is actually accessibility. And so, it's easy to say that like anybody can access these things at any place. But I mean, if you have a really busy job, if you have multiple kids to take care of, that becomes very difficult. Now, when it comes to routine vaccines, we do think that the biggest part of the decline has come from lack of access, right? Whether, schools have been closed or family doctors' offices have been shuttered. And that's definitely not the school's fault, not family doctors' offices' fault. Public health has been too busy to catch up. It's not their fault either. And so I think that, and I certainly don't think, and I really hope that, COVID vaccine hesitancy is going to bleed too much into those other vaccines. And that's where I think really working on the access piece through things like, pharmacies having these vaccines is going to be the main driving factor in recovering our routine vaccine uptake, which has fallen so much.
Okay. And Christine, we're getting some specific questions, so maybe I'll shoot them your way as a family practitioner. People are asking, should we be worried about getting more than one shot at once? Can our immune system be overloaded? That's a common question.
Oh, you have 2 arms and 2 nice derrieres. That's 4 needles, often with different types of vaccines in. There are very few times that co-administration is a problem, very few. And initially when the COVID vaccines rolled out, it wasn't a really significant medical concern. It was out of caution. We just didn't know. So it took us a year to say, okay, there's no safety signals. Just in time for our influenza campaign, God bless NACI, they said we're good to go, because I couldn't have imagined trying to coordinate influenza shots with COVID shots with catch-up. I truly think, the 2 big issues are accessibility, which we've discussed at length, and education. Education for our patients. Why do I think, as your family doctor, that you should get X shot? Not global statistics. You in front of me, Mr. Smith, who is eligible for a shingles shot, knowing your health history, knowing the fact that you want to visit your grandchildren who have yet to be immunized against chickenpox. Why are you at risk? Type of thing. So these catered, very time-consuming conversations have to happen. And on the topic that Jian mentioned about vaccine hesitancy, inevitably those calls come into my office at 4:45 on a Friday, and I have to take them, right? Because it's those patients who aren't necessarily, the patients who are completely anti-vaccine aren't going to call. It's the patient who wants some reassurance from somebody who knows their personal situation. So my pregnant patients who say, this is my first pregnancy. This is such a precious time in my life. I'm scared. Can you explain to me why it's safe? And, just give me permission, Dr. Palmay, because you've known me for X number of years. And I think that as primary care providers, we forget, the privilege of that relationship. And so those extra few minutes actually do translate to huge outcomes with vaccine uptake. That's been proven across the board in studies, any vaccine.
And I'm going to keep you there with another really specific one. Someone's asking, especially for children, a lot of people have these vaccines. Are they mandatory? People are confused about this. Do you have to get them, or do you have a choice there?
Well, they're mandatory for a lot of schools, right? So if you haven't had your standard scheduled vaccines, then the school will notify you and not necessarily allow your children to attend class. There's some optional vaccines for children. Meningitis B is an option, travel vaccines. So not mandatory, but as a primary care doctor, I spend a lot of time explaining the idea of being proactive, particularly after these past 2 years. We're trying to vaccinate ourselves out of a pandemic. We have only the choice but to be reactive. So let's step back and say, going forward, the pandemic is here to stay. It's going to be a frenemy to the medical care system, but we have some wonderful ways to be proactive for other vaccines. And so those intimate conversations, I think, are absolutely essential.
Great. And Kelly, I'm going to jump to you, but I just want to note someone sending in that the Can't Immunize app is great, but it is an honor system. So, you put that in voluntarily. Their concern is people can cheat and say they're vaccinated, but we have to find a way of cross-referencing that with actual health registers, I think is a good point. Now, I want to go back, Kelly, to Christine mentioned, that the importance of talking about this, about education. Is there a role for pharmacists for this? Pharmacists, we know, are the single most accessible health providers. You can just walk in and ask a question. Do you have an important role there on vaccination?
But interesting things happen in the pandemic where pharmacy has been the one place people could call and talk to somebody. So what that means is every time NACI, the National Advisory Committee Immunization, makes an announcement, sometime in the middle of the day, all of a sudden the pharmacy phones start ringing off the hook. And so actually what pharmacies have had to do specifically is often hire people just to answer phones. And some of those phone calls are sourcing the vaccination. Usually when a new group is announced as eligible, there's a whole amount of phone calls, just can I get my vaccine, my dose, my booster, whatever with you. But an awful lot of those questions are people saying, I don't understand this announcement. Can you explain this to me? I don't understand what this means. Okay, so I can mix and match. I don't understand that. What does that mean? When I was vaccinating, a lot of times people who are a bit nervous, they come to you, they get to the chair, but they're still really afraid. And when you slow it down and ask questions, a lot of times I had people who hadn't had a single vaccination since childhood, and they might be in their 60s. So you're covering a lot of ground in a short period of time just to give what in this case is a COVID vaccination. Sometimes it's fear, sometimes it's just that they don't know. And what we're hearing from pharmacies is a lot of that is happening. People are coming in and they're bringing up questions. They haven't talked to anybody about vaccination in a long time. They might not have a family doctor. They might not be connected to the system. They might have a family doc that they never see. So all of a sudden the pharmacy is the place that they go. And, it's been a lot for pharmacists because I think the workload involved in those conversations is enormous, especially when you start getting into mandates. Some of the people who come in who don't want the vaccination, that brings with it a lot of discussions about misinformation, which is also a very heavy and difficult conversation to have. So I think a lot of our healthcare providers, we kind of trained them how to talk about vaccine hesitancy. We kind of trained them how to talk about misinformation. But I think this is probably something we've identified is we really need to train them well on how to have good, effective conversations that people actually feel good about getting vaccinated once they've had this conversation. So yeah, enormous role for pharmacists. I think probably though anybody who vaccinates is having a lot of these conversations right now.
And not to bring up a testy issue, but pharmacists don't get remunerated specifically for those consultations.
Oh, and that's a big issue where we think of a vaccination as a technical task, which is just a needle and a deltoid, right? Getting a vaccination into a body. And what we're learning through the pandemic is for a lot of people, yes, the first dose you can get, you're going to show up, you're going to give them your arm and you're going to get out. That's fine. It takes very little time. What we've learned about record keeping, for example, is the record keeping for primary care and pharmacy. It's those COVAX type systems. It's the recording of it in the electronic system adds an enormous admin burden. So sometimes they're just hiring people just to put records into systems, right? Hiring a high school student, hiring teachers. We had teachers that would get hired over the winter break just to help put records into systems, for example. So that is a real challenge, as well as those conversations. If it takes 45 minutes to get a needle into an arm because someone's afraid for one reason or another, you're still only paid the very nominal fee that really is intended for a 5-minute vaccination. So yeah, we probably do need to rethink how we support this kind of communication about this.
Right. And you mentioned the fear factor. I'll just give a shout out to another great campaign. It doesn't have to hurt. If you put in that hashtag on social media, get some really good tips, especially for children who are scared, how to distract them, how to make them the experience more pleasant. Because I know in my generation, it was a very unpleasant experience. And for kids today, I think it's a little easier to get the vaccines. Now, Joe, a couple of questions I want to throw your way. A good question about, traditionally vaccination has fallen exclusively on public health to promote, to administer. What about the role of business and private enterprise? Don't they have an interest in promoting vaccination in the workplace, keeping workers on the job, et cetera? Talk about the role of business in this.
Yeah, no, I mean, I think they played a huge role during the pandemic, actually. I mean, I think before the pandemic, they would sometimes support things like workplace influenza clinics, workplace tetanus booster clinics. But during the pandemic, I think they've been forced to dragged into this health realm, for better or for worse, because truly COVID vaccination is a health issue, a business operational issue. And I've seen so much good work done by so many employers. I mean, they've really had to, right? Because when you think about the number of touch points, for example, you have with your doctor or your pharmacist or public health, you have the least, I think, you have way more touch points with your employer. And they are actually one of the most trusted sources of they're broadly trusted in the country. And so, not only have they had to do a lot of education around COVID vaccine to their own employees, they've come together and, done things like large scale immunization clinics in Ontario and other provinces. They funded like vaccine uptake campaigns, like the This Is Our Shot campaign. And I really hope that, there's always going to be a role, I think, for them in COVID. We'll probably need boosts and whatnot. But I think that, this pandemic has really shown, I think, how health affects people's productivity, mental health especially, but also physical health. And I think they really can be excellent partners as we begin to think about how to promote other adult vaccinations and vaccinations for employees' children. So big kudos out to business, actually. I think they've done a great job.
But can they do as good a job, like say with shingles? The uptake of shingles is very low, but one of your employees has shingles. They may be off work for 10 days, a month. They can be really nasty. Is there a self-interest there in taking a more active role, especially if their insurance plans cover the vaccine? Shouldn't they be promoting it?
Yeah, I absolutely think so. And, I've worked with hundreds of businesses, and I think that they recognize the importance of keeping their employees healthy, both because it's a generally good thing to do and because it improves, overall productivity. I think that this is where, though, you really do need multi-sectoral collaborations because, in the same way that I'm not an expert in extracting, oil sands production in Alberta, so too, I would say they're not necessarily experts in the host of vaccinations that exist. And so I absolutely think that they can promote other vaccinations. I absolutely think they're quite willing to do that, but it requires them being linked up with, folks like Christine and Kelly so that the information they provide is accurate. And, if those sorts of relationships can stick into, the post-pandemic era and into the future, you're basically able to mobilize such a large new body of sort of resources to get these things done, get people educated. So I really hope that sticks.
Christine, another practical question for you. You mentioned earlier the need to catch up on people. So someone's asking, I missed all my childhood vaccinations during COVID. How do my kids catch up? What do I do practically as a parent?
So the question is whether it's part of the routine schedule. Those would be well baby visits. That's well laid out. Reach out to your primary care doctor. We'll have records as to what's due. For the school-based programs, it's a little bit confusing. You have to call public health or the school to find out what shots were given. In Ontario, grade 7 students received 2 shots of HPV, human papillomavirus, 2 shots for hepatitis B, and 1 shot for the quadrivalent meningitis immunization. So each school is different, and sometimes I'm giving patients 2 shots, sometimes I'm just doing their catch-up shot. So really information sourcing, then reaching out to your primary care doctor. And, it's a bit of a circus, but it's not that complex. As long as I know what to order, they're just booked in. And then, like I said, an opportunity to have a discussion with the parent that brings them in and say, let's do a little bit of an immunization scan of your chart and see what you're due for. Talking about fear, though, and those conversations, I found a very excellent strategy is discussing with a patient a lack of trust in the system because of guidelines that are confusing, lockdowns that change, which erroneously gets translated into a lack of trust in the medicine. Medicine is science, and science evolves because it's science, right? And when I say to patients, I understand your frustration about lockdowns and guidelines that may not make sense, that's the politics. I believe in the medicine's steadfast. And that simple statement has actually gone a long way. So just another tip for our healthcare providers.
And Kelly, another thing that's come up during the pandemic is this realization that, well, vaccines aren't 100% effective all the time. So how do you juggle that one? People are always sort of taken for granted. My kid gets their vaccines, they're going to be magically protected. COVID has challenged that notion. It doesn't work all the time. How do you have that conversation?
It's pretty wild what people know now about vaccines, right? You know, people went from, they knew they had to get their kids vaccinated to now they actually understand. They understand, oh, this one's an inactivated vaccine and that one's a live vaccine. And, you know, all of these new concepts, which is wonderful. And I think we've kind of touched on that, how we can really use that a lot. But, you know, I think the real challenge here is that people are more aware, people are more willing to talk about these things. But I think, you know, they still don't necessarily know what they're eligible for when they're eligible for something. And I don't think we can underestimate the impact of that barrier. You know, and we've seen this over and over again with COVID, where another group becomes eligible another time. And the big question emerging right now that I think is in the probably the hardest one we've dealt with so far with the pandemic is how many of these vaccines am I actually supposed to get? Like, is this, do I get 5? Do I get 10? Do I get one every year? And there's a bit of catastrophizing going on because we actually forget that for most of our vaccinations, childhood vaccinations, there are multiple doses. There are 3, 4, 5 doses. That's actually normal. They just weren't paying attention. They didn't realize that before. So I think that's a shift. And part of that is because these vaccines are not 100% effective. Most vaccines are not 100% effective. The flu shot, we've often, you know, that's the one that most lay people will know we struggle with efficacy. The other ones are really good though. And I think where we've gotten to a good place is talking about what effective means. When we vaccinate, what's the goal of vaccination? With COVID, people imagined it was going to solve all our problems. You were going to get it, and then you couldn't get COVID, and it was going to be 100% effective forever, and it was going to protect you from being contagious. And then, you know, Omicron, which has just really upended everything. But this is true, you know, other vaccinations as well. It depends on the virus and the goal. So the goal with COVID is we're really just trying to, right now, to keep people out of hospital. A mild case of COVID might feel like crap, but it's a lot better to get that because you're vaccinated than get a severe case that winds you up in hospital or dying from COVID. It's the same thing with other vaccinations. You know, you might have a mild case of something because of those child vaccinations that you got. You might be less contagious if you are exposed and you do get infected. These are just new concepts for the public that kind of took for granted a vaccine is a yes, no, it's a black-white binary. They were never black-white binaries, but how wonderful that people actually get to know this now. I'm worried with the misinformation and anti-vaccine rhetoric that's taking on a life of its own. And I think actually one of our biggest jobs is to try and pull that back and help the broader population understand what we're really talking about when we talk about vaccines.
I'll just remind the audience again, there's about 10 minutes left. If you have questions, you can still sneak them in. I'll try and work them in, but running out of time for the questions. Joe, I want to ask you one of these big questions that all of you have kind of hinted at in passing. You know, we have this paradox right now that never has awareness of vaccines been greater, but never has hesitation about vaccines been greater. So how do we juggle that? How do we get people's confidence back now that they have all this knowledge?
Yeah, no, that's a really good question. And I think that it's a really good thing that people care more about vaccines and know more about vaccines than ever before. And, you know, when it comes to trying to sort of bridge that lack of trust, that misinformation, what you really need, I think, is as many sort of different people articulating in different ways the safety, efficacy, and importance of vaccines as possible, right? So if I imagine a world pre-COVID, right, in Ontario, you would mostly talk to your family doctor about vaccines. Family doctors are very trusted. I love family doctors. And then COVID comes along and you begin to talk to your family doctor and then pharmacy, and maybe you'll even get a call from public health once in a while. But then you have all these community groups that have come in, right, to really bridge some of those gaps and bridge that mistrust that happened. There've been so many examples of that all across the country, all across the continent. You know, talked about large employers, now talked about like so many of the community groups serving racialized populations or Indigenous groups. And like, you know, the more trusted voices you have articulating their importance, and different people trust different, you know, like different sources of trust, right? Like I may really, really trust my pastor to church. You know, I may really, really trust my employer. The more you have that, and the more you equip those people with accurate information, they don't have to be super experts, but just generally accurate information. You know, the more that we can sort of, deal with this misinformation thing. And it's not a trivial task. I view this as almost like high-level information warfare, where, you have like a lot of bad information, probably a lot of good information too, but the more sort of good news flowing into people's, phones and televisions and through conversations, the better spot we'll be in. We'll see how much sort of bleed over there is from COVID vaccine hesitancy, which has really reached unprecedented levels to other vaccines. I hope there's very little, but we don't quite know that yet. And we got to prevent as much of that from happening as possible.
Okay. And Christine, I'm going to ask you the same question. I know you talk about vaccines a lot in the community. How do you bridge that gap between the greater knowledge but the greater hesitation?
Well, I'm not actually sure that there will be a greater hesitation to get the shots. I think we have to get the accessibility equation out of the equation first. I find that I'm having more discussions about vaccines just because of context with patients. And, the two strategies I use is the idea of trying to understand where that hesitation comes from. And truly, much of it is just the system at large and a frustration that we're in our 18th lockdown. I don't know what to do, which I really try to separate from the medicine. And then I think having those catered conversations. So when you have an education campaign, not just listing vaccines, according to demographics, but having risk factors included. If you're over 50 and if you have COPD or asthma, if you're diabetic, why are you at increased risk? And one thing that was also mentioned is consistency in messaging. So my message in my office gets relayed at the pharmacy, gets relayed when a patient goes and sees their dentist, so healthcare working together to provide consistent, repeated messages.
Great. And Kelly, I'm not sure if you're the right person to ask this, but I'm going to throw it your way. A question about HPV. We've talked about young children, we've talked about older adults, but that kind of teen market, the human papillomavirus, are we doing a good job of that teen market? Is there a role for pharmacists there, or does that have to be done in schools too?
Oh, that's a great question. So I have a 12-year-old who became eligible for her HPV vaccine this year. And what was interesting is we got the email early in September. And this goes back to another question someone had asked earlier. Because I'm very much looking for this. I know this is a grade 7 scheduled event. I'm expecting it. So as soon as the email came through from the school board, I made my appointment. I got in my car the day, I drove to public health, I had to pay for parking, we had to walk through a building that was unfamiliar, we got in a weird lineup, she got caught up on her doses. We went through this whole process, and then we went home, and I was really surprised because I thought everybody would have done that. And then I talked to close friends, those around us, no one else had taken their children because they missed the email. They didn't notice that the email had been sent out. Now, I also work in the vaccine rollout in my region for COVID. So I work a lot with public health, and that's a newer role for me. And what I found interesting was what was also happening around that time is those individuals at public health who run those school-based clinics. So, how do you go in during a pandemic into school and vaccinate with appropriate PPE and distancing? There's getting to be some violent rhetoric around vaccinations. So schools are starting to get leery about having vaccines provided at schools because there might lead to violence or protests. There's concerns there. But the thing that we also missed is the people who actually go into schools and put needles in arms got redeployed to boosters. And just as they were getting going again, for the first time in really 2 years, they're getting pulled back out again. And as a fourth dose emerges in long-term care and other places like that, those same teams keep getting redeployed to other places. We're about to go through, Paxlovid, this antiviral, that raises a whole bunch of new questions. And the pandemic keeps distracting us. I think that's the one thing I've learned is the thing that works really well for that age group is going into the school. You get enormous amounts of children vaccinated by just bringing it to them. We are seeing with COVID, and we have low uptake of COVID childhood vaccines, the 5 to 11. We're going back to those questions. We need to go into schools. We see that's especially important for places like urban environments. Places, not the suburban, but the urban schools where you might have lower uptake. So I actually think there might be a role for pharmacy. And I along with primary care, when parents are worried their children have needle fears, they might opt to not do it at the school program. They opt for a more comfortable environment like the family doctor. But those aren't the majority. Those are a minority, and those are special circumstances. I could see the pharmacy supporting that. But when I look at the grade 7 shots and all the catch-up, I think they could be good for catch-up, but we cannot undervalue or underestimate the enormous impact of school-based programs. And we have to be very careful we don't shy away from them. That's something that I am worried that we're going to head into.
And John, we're almost out of time, but I want to ask you, someone's asking, who's doing this best? Can we compare the provinces? And I'm going to preface this with a shout out again to a group called CanAge. They have a report called The State of Routine Immunizations in Canada, which gives essentially a report card. They published one last year, there's another one coming out next week. So the answer to this is coming in detail, but I'm going to ask you to give you a short answer of who's doing this well.
Yeah, well, there's different dimensions of best. I think Ontario is the only province that's actually covered the Shingles vaccine, which we all really think is excellent. And so, kudos to them. When it comes to actual uptake of routine vaccinations, Alberta's actually seen the lowest decline because it is completely almost centralized within public health. So, I don't, want to say Alberta's better. It's just the context matters a lot. But we know that what we need to do is, no matter where you are, make it more accessible based on sort of the context you have, right? And so even in Alberta, it's very difficult to get a catch-up vaccine because public health is too busy, right? And so if you miss it when you're supposed to get it, you're kind of done. It's probably easy to get catch-ups in Ontario in some ways, actually, because it is through a family doctor. But, at this point in the game, we basically just need to, do whatever we can and really activate the people who aren't getting redeployed every time, to Kelly's point. And that's what's going to, really increase that access piece. And then the coverage piece, which is also very important, is making the vaccines actually free. We tend to think of vaccines as universally being free, but they're not all free. And, there's some that are excellent that are not covered by the provinces. And, it's really important that as many provinces cover the shingles vaccine as possible.
So we're almost out of time. So I'm going to ask, I like to end my panels on a positive note, especially in these dark times. So I want to ask each of you just a 1-minute answer. What makes you hopeful that we're going to do a lot better? You all hinted at this, but how are we going to do better at vaccine uptake and availability and accessibility in the next little while? Christine, I'll start with you. I know you're by nature hopeful. What gives you hope in this area?
I think public awareness, being able to discuss NACI, a newfound appreciation of relative risk, the implications of not being vaccinated, access to gyms, etc. I think that's a new springboard. I call it riding the COVID pivot, but really using that base new knowledge and translating that to vaccine discussions that we couldn't have before. That 4:30 call that comes on a Friday, I often, just remind myself that, good medicine treats disease, excellent medicine prevents disease. And I think that philosophy going forward is going to go a long way.
Great. Kelly, I saw you nodding there in agreement. What makes you hopeful?
I think everybody, if you're in healthcare right now, you're vaccinating. And it's interesting because we are working together in ways we've never worked. We often oppose one another. So pharmacy wants to do something, well, primary care doesn't like that idea. Primary care wants to do something, well, emergency doesn't like that idea. Public health wants to do something, well, other groups want to do it too. So is it a public health role? Is it others? The pandemic, we've just all worked together. So we've got paramedics vaccinating. You train them to vaccinate in a mass vaccine clinic, all of a sudden they become a great team to do home care vaccinations. So a level of training and openness and competency that we have now around vaccination, I think has taken a lot of the silos away, and we actually are a team. So when we go back, we have new options now to build a much more accessible system. And I don't think we're going to oppose each other in the way that we used to. I think we're actually we kind of like each other now, as opposed to not really know each other and just say like, oh, that's their area. Now we're friends, and we all worked side by side in all these different settings. In a really tough couple of years, we burned out together, right? So I think we're actually going to come back and rebuild it together in a way that's much more comprehensive.
Yeah, there's a lot of vaccination work to go around, so you don't have to fight about doing it. Everybody can do some. Ja, I know 19-0, the initiative you're involved in is by definition very hopeful. So send us home with a hopeful note.
Yeah, just expanding what Kelly has said, friends are really important. And it's not just healthcare partners being friends with one another, it's the health system with everybody else. At times it's been very frustrating, trying to get a vaccine or figuring out what the heck's going on. But We see more collaboration across sectors on health than ever before, and we'll need to continue that to sort of address these issues that we've talked about today, which are very, very urgent and pressing issues. And so, yeah, the more we make friends, actually, the better we are. And, you know, that actually has been happening throughout the pandemic, and I hope it continues to happen.
Great, wonderful note to end on. Thank you to our panelists, Jia Hu, Kelly Grindrod, and Christine Palmay. Thank you to the audience for being there in such large numbers, for your great questions. And I'm going to throw it to David Simmons to send us home.
All right, thank you for the expert moderation, as always, and for steering us through that conversation. Doctors, thank you for the work that you've been doing over the last many, many years, but particularly over the last few years of the pandemic. I appreciated your insights and your call to leadership for so many of us across society. I also appreciated your acknowledgement of the work that your colleagues are doing across the healthcare spectrum. Allied health professionals really have been allied in the last few years, and it's bearing fruit. So thank you, thinking of you and sending you best wishes as we see, hopefully, a turn in this pandemic and in the way that we access care in this country. On February 9th, no, I'd much rather do this in person. I want to thank our sponsor, GSK. We appreciate your generous support for this discussion and the work that you're doing in innovative medicines. Thank you as well to our AV supplier, Van Valkenburg Communications and MediaEvents.ca, for making this event possible. And we hope you'll join us for some upcoming events. On February 1st, we'll be joined by the CEOs of Lululemon and LifeWorks, as well as Olympians Ashley Lawrence and Haley Wittgensteiner, for a conversation on mental health and well-being in sport and in business. And on February 9th, we'll be joined by Burt Clark, who's the CEO of IMCO, and Rashay Jahalhal from CEM Benchmarking, for a discussion on their recent report, A Case for Scale, quantifying how large institutional investors add value. To learn more about our upcoming events, visit our website, canadianclub.org. You can also browse our archives and enjoy past events. You can also join us and become a member to support conversations like the ones we have today. Guests, thank you for joining us. Stay healthy and stay safe. Bye-bye.